And welcome back in. How to talk with an aging parent about hearing loss. Well, it's a question many children may be facing now after noticing changes in a parent's hearing over the holidays. Joining us to discuss this, Dr. Haley Owen, an audiologist with Livingston Hearing Aid Center. She's here to share tips on how to start that conversation. Dr. Owen, thanks for joining us.
Thanks for having me.
Absolutely. What can people expect when they first meet the audiologist for the first time?
So first, we're going to ask some questions about your hearing loss. It's, good to know some of the situations where you're starting to notice difficulty. Maybe the TV's a little bit louder. Maybe you're having to ask people to repeat, things like that. Then we're going to take a look in your ears. We want to make sure that overall ear health is good. It's not just wax or something kind of simple like that. And then we're going to do a hearing test so we can evaluate the severity of the loss and find out if it's something that can be treated with hearing aids.
And Dr. Owen, why would people, or specifically children right now, actually be facing this question?
So, we're coming out of the holidays. We've spent some time with family members, probably more time than we typically would have. Probably haven't seen them in a couple of months. And a lot of health issues, specifically hearing loss, can become more apparent when you haven't, seen someone in some time.
Excellent. And so now the question is, well, how do you actually bring up this topic with a loved one?
Yeah, it can be difficult. A lot of people associate hearing loss with aging. Nobody wants to admit that they're getting older. So bringing up this topic can be sensitive. Usually we recommend just, starting things that you've noticed, bringing the conversation that way. Hey, Mom, I've noticed that, you have the TV up a little bit louder than you used to, or you're having to ask people to repeat themselves a lot more often. It's a good way to bring it up. A lot of times the person with the hearing loss is the last person to know. It's such a gradual thing that sometimes they need for us to kind of step in and let them know what we're noticing.
Excellent, Dr. Owen. That makes perfect sense. Is there a common question hearing loss patients usually have for you?
A lot of times people just want to know what's causing it, and that can be difficult to determine. What we do know is that the sooner we can treat a hearing loss, the better. So we recommend having your hearing tested at least once a year. The sooner you can find out the loss, the better. The sooner we can treat it, the better. It can also help to put off some of those other health consequences that come from untreated hearing loss.
Excellent. Dr. Owen, any other advice for us?
Just like I said, it's never too early to get your hearing tested. So like I said, at Livingston, we always recommend having your hearing tested once a year.
Excellent. Dr. Owen, thank you for joining us.
Thanks for having me.
All right, we'll stick around here. We do have more news for you up right after the break.